For this week's dental segment, we're going to talk about options with toothpaste. Joining us once again is Dr. Bruce Goeringer from Goeringer Family Dentistry in the Back Mountain. Dr. Goeringer, good to see you this week.
Good to see you again too, Dave.
So with toothpaste, there's a lot of different options. You have your traditional toothpaste and there's others.
Well, you have the classic toothpaste, which is the fluoride with the silica. It's either in a gel or a paste. And that material just cleans off the surface of the tooth, and then the fluoride is able to get into the enamel and create a situation where that enamel is actually resistant to decay. So the classic fluoride toothpastes have been around for a long time, and they still work great. They're still a great dentifrice to use for your teeth on a daily basis.
You know, you see and hear so much these days about whitening toothpaste. What are the deal with those, and do you have any recommendations when picking out a whitening toothpaste?
Well, there are various whitening toothpastes. I don't want to get into recommending one because there are a number of good ones on the market, and I don't want to favor one over the other because the Procter & Gamble and Colgate and the other companies are constantly trying to outdo each other, and they all produce good whitening toothpaste. But the toothpastes that are over the counter are generally silica toothpaste. They polish the surface, and they don't necessarily bleach the teeth. They'll have detergent type agents that'll clean the teeth, but they're not real bleaching. They're more of a whitening toothpaste, and they will whiten the teeth because they power away the stains that are on the surface.
And what is the deal with an oxygenating toothpaste? What does that do?
Well, oxygenating toothpaste will oxidize material that's on the surface. That actually has a little bit of a bleaching effect too. But the oxygenating toothpaste are generally for people with periodontal disease, who have pockets between the tooth and the gum, and they're in danger of losing their teeth. So the bacteria that are down in the deepest part of the pockets are anaerobic bacteria. They thrive in an area where there's no oxygen. So these oxygenating toothpaste will actually help to limit those bacteria and hopefully combat the periodontal disease and bring the person back to health.
And there are a few other options out there as well, Dr. Goeringer. We're starting with breath freshening and other options as well.
Yeah, the breath freshening, tartar control toothpaste, they all work well. These are toothpastes that have been researched over the years, and they do help. I mean, breath freshening, they have various agents that will freshen your breath, again, oxygenating agents many times. And the gels and the pastes all work well. There are combination toothpaste, too, that try to do everything. The one that comes to mind is Colgate Total. Crest has another one that's very similar, and there are other ones out there, too. But they try to do everything at once, and they're very effective. You just have to be careful because there's so many different agents in these toothpastes. Sometimes you're allergic or you have a reaction to one or the other. And you might have to go back to a more basic toothpaste if that's the case.
You wouldn't necessarily think of it, but there are so many options with toothpaste. And Dr. Goeringer, for our viewers that have questions or need to set up an appointment with you, how can they do that?
Well, I guess they'll look at the display in the stores and realize there's so many toothpaste there. They can ask us about it. Again, the phone number is 570-675-3646, or the website is drgoeringer.com.
All right, Dr. Bruce Goeringer from the Goeringer Family Dental Practice in the Back Mountain. Thanks so much for being here. We'll see you again next time.